Hello everybody, my name is Danny, also known as PsyDreamer on this channel from now on. Today I will be talking about my experience in the emergency room, as you can tell by the title. So as you can imagine, it was not a fun experience at all. I honestly wish it didn't happen, but yeah. So that day, Tuesday, January 16th, 2024. So for a little backstory, I guess you could say, I average about at least one seizure a month. Most of them happen at night and they usually wake me up from my sleep. Or it happens when I'm falling asleep. I don't really know. I just know that I'm in some state of sleep when they happen. On average, I have about 1 or 2 hours a month and at least one seizure a month. That started last year. So I didn't go to the hospital because I don't have insurance anymore. This video is mainly about my emergency room trip. I will be making a separate one more on my seizures in general and how all of that started. But anyways, these seizures for me only last a few seconds, maybe a minute at most. And after it was over, I kind of, I'm gonna take it easy, that sort of thing. And that's what I did. So I waited for my boyfriend to get back home from his job. And I told him, hey, can you pick me up some CBD so I can maybe calm down a little because I'm feeling kind of anxious after that. And so he's like, yeah, sure, and goes to pick me up some CBD. So he goes to one of the nearby shops and buys me some CBD gummies, or at least we thought they were CBD gummies. He said the girl at the counter told him that these were CBD gummies. Clearly she didn't really look at the bottle, the label, or something. Because I ate half a gummy. After a little bit, I started feeling kind of funny, and I'm like, I don't think this is CBD. And I checked the bottle. It's Delta 8. Now, this isn't my first experience getting high. I'm gonna be straight up about that. But I laid off of that around 2022 because I was just having really bad anxiety and PTSD that year. Getting high wasn't really fun for me anymore. It was starting to make me more anxious, especially after one particularly bad trip where I took some really, really strong THC. I didn't want to mess with that anymore. But again, that's a story for another day. The Delta 8 hits me, and so I'm like, great. The Delta 8's hitting me. I'm probably gonna be high as a kite in a little bit, and I'm freaking out because I haven't gotten high like that in a good while. So I think to myself, okay, I guess I got no choice but to lay back, take it easy, try not to think too much about anything negative or upsetting. A little bit after I went back to lay down, I start feeling weird, is the only way I can put it. And I thought I was just imagining the metallic taste, which I usually get during my auras. I got a little nervous because I'm like, great, am I gonna have one? Am I not gonna have one? What's going on with me? But I just try to remain calm. I brush it off. I'm like, you know what? I'm probably just imagining it. Not long after that, I start feeling my body kind of lock up. And I start twitching. I have video of this happening, but I don't really want to post it because you can't really see much anyway. I start feeling my body kind of locking up and doing this twitching. And I call my boyfriend. I'm like, babe, I think it's happening again. I'm not always aware, but in this case I was. I don't know if the Delta 8 had something to do with it or what. I'm not always aware when this happens, but I guess the Delta 8 was doing something to make me aware. I don't really know. But yeah, I told him, okay, if it's more than 5 minutes, that's when we gotta worry. But this particular time I got worried because I've been used to just having one a month. And in this case, I'd already had one of my sleep seizures 2 weeks before. So I'm like, okay, it's changing in frequency. That's kind of worrisome. And then for me to have another one later that day, I mean, clearly it was a different type, but why am I aware? That sort of thing, you know? I knew something was definitely up by now because I've never had 2 seizures in a day before. So I told John, okay, I think we're gonna have to go to the hospital. I really didn't want to go to the hospital because I knew that if they were going to do blood tests or any of that, it was going to show up not clean, you know? But on the other hand, if I don't get treatment, like right now for this, I don't know what's going to happen to me. I can't afford an ambulance. So John, my boyfriend, called an Uber. And we're waiting for the Uber, and he's putting my shoes on for me because I can't really do much. Because he had to carry me to the living room. And I got him to take Mr. Carrot too because I knew I was going to be scared in that hospital. We Ubered to the nearest emergency room, which doesn't have the greatest reviews, but at that moment, everything was kind of a blur to me. How do I put this? It felt like I was having several seizures back to back, but for some reason remained aware. And I know it's not a panic attack. I know it wasn't a panic attack because I've had panic attacks several times before, and this was not like any of them. I don't know how to explain what I felt, but I had this weird illusion going on, which I didn't realize it at the time, but I was entirely convinced that this is my big moment in life where I just have to overcome this. This is my big thing that I gotta overcome, and then everything's gonna get better from here. I was just in a really weird place at that moment. Everything's just kind of a blur. I don't remember much of it very well. I just know that John Ubered me to the hospital, and we didn't really know how to get to the emergency room, so we went to the main entrance. Hospital doesn't really have the best reviews in town, but at that moment we didn't really care because we just had to get to the nearest emergency room like right now. I don't know how many seizures I had been having back to back or how long it had been. I just know that it had been a while, and I wasn't feeling good. I was scared. I was terrified. The moment I got inside the hospital, I just started crying because I'm like, great, what's going to happen to me? Am I going to die? Is this it for me? Is this how I die? Because I was convinced I was going to die. I had this really intense feeling of impending doom. We got to the emergency room because the lady at the desk told us how to get there. John had to put me on they had to put me on a wheelchair because they didn't want me to fall on the floor. And this was the beginning of a 36-hour-long nightmare for me. Before they take me to the pit, as they called it, which is where all the patients were waiting to be seen, they measured my heart rate, which I don't remember much. I know my blood pressure was 111 or something, because I remember seeing that number. This little alarm thing went off on the monitor. I didn't see my pulse at the time, but when I went back to check my records, it was 138 beats per minute. And looking back now, that's kind of alarming because it was that's a pulse you see when you're doing cardio, not whatever I was doing. So my pulse wasn't looking very great or feeling great. My heart was beating so fast, and I couldn't calm down. I was just in this state of constant seizing. I don't know if it was a cluster seizure. I don't know if it was PNES. I don't really know. I'm just waiting for answers. All I cared about in that moment was I want answers. I want to know what's happening. Most importantly, I don't want to die. Years ago I thought I did, but at that moment I realized I don't want to die. There's a lot that I still want to do. They take me into the little waiting area with all the patients. This is going to sound kind of funny, but I also remember being really uncontrollably gassy and scared. And I honestly feel so sorry for all the patients in there that day that had to smell my farts because I had a hard-boiled egg that day. Only I could find humor in something so traumatic for me. It felt like I was in there for hours. I don't know how long I was in there for. My boyfriend was guessing I was in there for at least an hour. Still seizing back and forth. I don't know. At one point, my chest started to actually hurt. I thought I was going to have a heart attack or something. I guess that happens if you're seizing too long. I don't really know. Still trying to figure this shit out. I was really out of it, but I do remember bits and pieces. The girl next to me, she had stomach cancer, and I remember she was in so much pain, and she kept begging the nurse, for help. I just know that I felt so bad for her, because I get that nurses have really busy jobs and they're overworked and all, but the way she talked to that poor girl, I was like, it just wasn't very kind. And I remember overhearing another man talk about he'd been in that hospital for 24 hours just waiting for an x-ray. And I'm like, great. Does this mean I'm going to be here for a good while then before getting treatment or what? Somebody calls my name, they take me to like the lab area and they're going to draw my blood. And I'm like, great. Just what I needed. For context, I don't handle getting my blood drawn well at all. I get nauseous, and even if I look away, even if I close my eyes, I will gag so hard just at the sight of having my blood drawn. So that really wasn't helpful. They do the blood draw and it sends me into my typical vasovagal reaction. I'm there gagging, trying so hard not to throw up. I don't throw up. Luckily, I was just gagging. But after that, the seizure finally stopped. I'm like, really? Now that I'm at the hospital, it stops? They take me in to see the physician's assistant. He asks what's going on. I was still uncontrollably farting. I don't know if that had anything to do with my seizure. Because I know people lose their bowels. I don't know if that might have been affecting my farts too. I just feel sorry for the nurses who had to smell those hard-boiled egg farts. They listened to my heart and all that good stuff, check my breathing. I did not like the doctor's face when he listened to my heart. He looked kind of freaked out. And I'm like, great, I hope it's not bad news. By then I'd kind of started to calm down from this seizure or whatever. They take me to get an EKG. I let them do their thing. And then they put an IV in my other arm. Oh, I almost forgot. They told me that they actually weren't supposed to do that blood draw on me. That was meant for another girl who was also named my first name. So I had to go through that unpleasantness for nothing. And of course they apologized for it and all, but I'm like, really? So that kind of was very upsetting to find out. So they do the EKG on me and all. They said it looks good. They also put an IV in my other arm, the one that didn't get the blood draw. I'm like, great. I had to get a needle in both of my arms. I gave this arm for them to do the blood draw on because I didn't want to be dealing with the discomfort on my good arm. Well, I had to do it anyway because I had to use my good arm for the IV. So they wheel me back out to that same little patient waiting area. They gave me saline and I tasted it in my mouth and smelled it. They're like, okay, that means the saline's working. That actually did end up helping me calm down a lot. They also gave me Keppra through the IV, and so I had to sit there for about an hour. So it was very uncomfortable. I'm sitting there in my wheelchair with an IV in this arm. So there I sat, IV in my arm, on my phone. I have some footage around. I started recording myself around this time because I knew I wanted to remember this so I could make a video talking about my experience. I hate being in here. I hope I don't have to be here ever again. It's Danny here. Guess where I am.
Yeah, this is just for people currently having treatments done. So anybody with like meds, fluids, stuff like that.
This is very uncomfortable. I'm mainly documenting this so other people with the same experiences as me don't feel alone.
And it's right out here to the right.
This is an extremely uncomfortable place to be.
Like right there. You just gotta go upstairs.
I'm finally getting started on Keppra, so let's hope that actually helps control my seizures. We'll see how this goes. I don't know how long I've been in here. I don't know how long it's been, but I'm halfway through the bag. I want to make a painting about today. That's usually how I deal with it when things like this happen to me. I want to make a painting just like Frida did. So I waited for like what felt like 15-20 minutes. I'm just waiting there for a nurse to come, like, please get this thing out of me so I can go pee, because I was so afraid that I was going to piss myself in the waiting room. A nurse came on time to unhook the IV. It was done. I was good to go back to waiting. Went to the restroom, go back to my boyfriend in the waiting area. It was about 2 in the morning around this time. We were waiting for them to call me. Guess how many hours we sat in that waiting room before they finally called me again. We sat for a whopping 13 hours in that waiting room. My boyfriend somehow managed to sleep in the waiting room, get a nap in. I did not. I was wide awake. I was wide awake that entire time. I only managed to get like little micro naps, micro sleeps. I found it impossible to sleep in there. That waiting room was full of sick people and people waiting to hear about their loved ones. It was miserable. There was a man crying very loudly, and I felt so sorry for him. There was another man in the waiting room. They gave him a bag to throw up into. This isn't right. How are you going to leave a sick person to just wait in the waiting room, vomiting into this tiny little plastic bag where there's other people waiting? I saw so many people in there, so sick and waiting for hours just to be seen. I don't even have words for it. I was left so speechless. They did call my name occasionally, but not to be seen. They were just consistently checking my pulse and my blood pressure, all that good stuff. I recovered pretty quickly with the saline and Keppra solution that they gave me. So by then I gained back my mental clarity, and I was just mentally processing everything that I was going through. My boyfriend had to get me McDonald's in the morning. I had a smoothie and a hash brown because I just didn't really have an appetite after all that. I ate a few graham crackers that they had at the hospital. By the time they finally called my name, I'd actually fallen asleep, so I woke up kind of startled. They finally take me in and put me on a bed. Not in a room, but in a hallway. It was better than being in the waiting room, at least, because by then I could not feel my butt from how long I had been sitting. I sit there for an hour waiting for what's next. Well, I'm in a bed. I don't know what they're gonna do, but gonna find out. I don't know what comes next. They asked more questions about yesterday, what happened, what I remember. Checked my body movement and all that, I guess. I don't know what to call it. Really wish I had my chapstick on me. Oh well. Alright, they're gonna have me do a urine sample. I already did that, but they're gonna have me do a CT scan next. This isn't my first time doing one. No contrast this time, though, so at least that. I just mainly want this IV taken out my arm already. 1 hour passes by. It's 4 p.m. They take me to do a CT scan and a urine test. I get all that done. I wait another 6 hours before they come see me again for the next thing. And no, I had not eaten this entire time. I was a little hungry, but I was more worried about what was going to happen to me. 10 p.m. comes along. They call me again finally for my EEG. I got my EEG done. It takes a while to set up because of some technical difficulties, but they managed it. Alright, you guys, I'm about to do my third EEG. This one's going to be 30 minutes. I am hungry, but I haven't eaten since this morning. I only had a hash brown and a smoothie from McDonald's. So, shmila. They do that EEG for 30 minutes. This wasn't my first one. I actually have a video of my second one that I did, which was a 72-hour EEG that they did at home. Maybe one day I'll make a video where I finally use that footage. They get that EEG done, and they wrap it up. Yo, I look a mess, but I'm done with the EEG. My lips are still very chapped because I left my chapstick with my boyfriend. There's glue in my hair, but hopefully we get some results out of that 30-minute EEG. They finished the EEG. Now I have glue all over my... Actually, speaking of the EEG, this painting I did is actually based off of that moment where I'm just sitting there with the EEG waiting and waiting. They take me back to the hallway. I wait several more hours and by then my phone was dying. And I'm like, great. I had to just kind of lay there, trying to sleep but unable to. You know how hard it is to sleep with a constant beeping of a monitor and hearing nurses walk by? I just couldn't get any sleep. I tried so hard. I was so exhausted. By this time, I had been awake for 2 days straight. I've never wanted to sleep so badly in my life until that moment. It was just too noisy for me to fall asleep. It was 11 p.m. by the time that I got back to that hallway bed. And I waited there for about another 10 hours or so. By the time I finally got to hear results back from the doctor about my EEG and all the tests, it was about 8 or 9 in the morning. They give me my results. They said the EEG was normal, which was really frustrating to hear. Anybody who has dealt with chronic illness would know why it's frustrating to hear that your results are normal when you know something's wrong with you. Well, they told me that the results from my CT scan and my EEG were both normal, but when I checked my chart, it said that the EEG was abnormal. I don't know. I just wanted to go home at that point. They told me that I'm not allowed to drive for 6 months. That's fine by me. I already gave up driving a long time ago when I got diagnosed with narcolepsy. But the no driving part was especially, they really urged me not to drive. They also told me no swimming, no taking a shower if nobody's in the house, all that. They gave me a prescription for Keppra, which they said would help with my seizures. I checked the notes after I was released. They're thinking it's PNES. I'm thinking it's maybe both PNES and epilepsy, which I will make a video on sometime whenever I can, and why I think it's both. So I started the Keppra, which I actually painted my pill that they prescribed here. I went in January 16th at night, and I came back on January 18th or 19th. I'm not really sure. When I got back home, the first thing I did was take a shower because I had so much of that EEG glue all over my hair. I also had to wash off all the glue from when they stuck on the EKG sticker thingies and all that good stuff. I took so many showers that week, and that glue was just not coming off. That glue is stronger than some people's relationships. Anyway, I took the whole week to just kind of take it easy. It was very hard. I spent 36 hours in that hospital, and most of that time my boyfriend was asleep, or when he did have to go to work, I was just there by myself. I didn't really have visitors that weekend because I wasn't sure I could have any, considering my bed was in the hallway and not a room. So it was just me and Mr. Carrot that whole stay. It was very hard to process that whole experience because of how traumatic it was. Painting really helped me with that. So as I mentioned, I was prescribed Keppra, or they gave me the generic version of it at least, and I didn't know that it actually takes some time to build up in your system before it really starts to work, so I did freak out when I got home and I had not 1, not 2, but 5 or 6 nocturnal seizures back to back. I called the nurse line to ask about my medication and is this normal, and they explained that Keppra doesn't work right away. It actually takes a while to build up in your system before it really starts to work. So I said okay. So they told me how it works and when to worry, all that good stuff. So I'm like, okay, I'm gonna trust the nurse line, and I did. I did have a few more nocturnal seizures the days after that, but I also wasn't too surprised because sleep deprivation is one of my biggest triggers, and considering that I'd been awake for 2 days, wide awake, I was not surprised. I'd actually kind of been expecting it. It would have been more convenient if it had happened while I was getting the EEG done or at the hospital, but the moment I finally recovered, I ate some caldo because the whole time at the hospital I was thinking to myself, when and if I get out of here, I want caldo. I called my parents, I'm like, hey, I'm at the hospital, I want some caldo de res really badly. So my parents brought me the good caldo de res, and I was really happy to eat it once I'd finally gotten some sleep and recovered and all that. I started taking the Keppra twice a day as prescribed, 750 milligrams. I almost forgot. Before I left, I went to pick up the medicine at the pharmacy, and when I saw the bottle, I kind of freaked out because I saw a bottle with some gigantic looking pills. There are 750 milligram pills that I was prescribed to take not just once but twice a day, and I couldn't help but think, did they make the right decision? Like, are they sure this isn't overdoing it? Because I've never taken pills that big. I thought I was going to choke on these, and then I come to find out that's not even that bad. There's people out here taking 1,000 milligrams, 2,000 milligrams of that, and I'm like, okay, maybe I don't have it that bad after all. I was scared to take those pills at first, I'm not gonna lie. I didn't take them right away. It took me like a day or two to finally start taking them. It was a hard pill to swallow. See what I did there? It really was a hard pill to swallow, realizing that it's either I keep having these seizures, or I take these pills that are kind of hard to swallow, literally hard to swallow, every day, so I don't have to have these seizures. It's not like I have a choice, you know? I didn't feel side effects right away. I was really worried about what kind of side effects I'd have, especially because a lot of people get Keppra rage, and that term refers to this really intense rage that Keppra can cause for some people. But the thing about medicine is that what works for one person might not work for another. So I just had to kind of take that risk because I was really scared that I was going to get the Keppra rage too. But I didn't. And I haven't. I've been on this medication for almost 3 months now, and I feel fine. I do occasionally get a little agitated or like some anxiety, but other than that, it works pretty good for me. I did have some intense nightmares the first few weeks, but I don't know if that actually has to do with the Keppra or if it's just a coincidence. Because, you know, I got narcolepsy too, so anything involving sleep or dreams, I can't tell what causes it sometimes, you know. That's how it is when you have several disorders. And that's the annoying thing. Neurological disorders like to come with buddies. I remember I thought, okay, it's just, at least it's just narcolepsy, you know, I can deal with this. I spoke too soon, because narcolepsy and epilepsy like to be buddies sometimes, and it sucks, but that's just how it is for some people like me. Well, they haven't confirmed yet that if it is epilepsy or not, but I'm pretty sure it is, because I'm still getting the intense deja vu auras. It's just they're really quick now, and they're still once a month, but it doesn't go any farther than that. I think yesterday I had an aura where I felt like that weird rising sensation in my stomach, because that's another common one, especially with the temporal lobe. So yeah, that was a very traumatic experience. I'm barely processing all that. Right now I'm just waiting to see the neurologist in May, which is next month. And I'm waiting to see what they're going to do and what they're going to tell me. I hope I get some answers. And I hope that they actually care about my well-being and actually care to look into things instead of just dismissing it as psychiatric, like most doctors nowadays do. I'm really hoping that they actually care about my well-being this time, that they don't just slap the psychiatric label on it like all these doctors do nowadays. As bad as this sounds, I'm really hoping it's not the psychogenic seizures, because doctors here just don't take anything like that seriously. From my experience, the moment doctors see anything psychological in your medical history, they're not going to take you seriously. It's frustrating. Here's some anxiety medication. Here. Shoot, go. Like, no, can you please actually take the time to look further into this? I know something's wrong with me. I've dealt with anxiety and depression since I was in the 8th grade. I would know what it feels like for me. I know my body. When I tell you that I know something else is wrong, you better fucking listen to me. Because I know what I'm talking about. It's so hard to find a good doctor now in this country. All of them are so quick to just dismiss you the moment they see any history of mental illness. Anyways, I went off on a quick little rant there. I'm running out of time and storage once again on my phone. If you've watched this far, thank you so much for staying. It really does mean a lot to me. My medical bills are... I need help with that for sure right now. I have a GoFundMe in the link in the description. If any of you is able to help me out with that, thank you so much. And thank you for hearing me out.